population. OA leads to significant limitations in daily activities, contributing to hospitalizations, surgeries, and even inability to work. The disease is characterized by joint pain, stiffness, and reduced range of motion, often worsening with use and sometimes persisting even at rest. Understanding OA's impact is crucial for effective management and improving patients' quality of life. Diagnosing osteoarthritis can be challenging, as there are no specific laboratory or physical tests. Instead, diagnosis relies on clinical presentation, such as joint pain, stiffness, and radiographic changes like joint space narrowing and osteophyte formation. Treatment aims to relieve pain, maintain mobility, and improve quality of life. Non-pharmacological therapies are foundational. These include patient education, exercise, weight loss, and cognitive behavioral intervention. Pharmacologic options start with acetaminophen for mild pain, progressing to NSAIDs for moderate to severe symptoms. In some cases, tramadol or other opioids may be considered, especially when NSAIDs are not suitable. Topical agents like diclofenac and capsaicin are useful for localized pain, and intra-articular corticosteroid injections may offer temporary relief. Surgery such as joint replacement is reserved for those with severe unresponsive OA. Rheumatoid arthritis, or RA, is a chronic systemic inflammatory condition that typically presents with symmetric swelling and tenderness in the joints of the hands and feet. Unlike OA, RA is an autoimmune disorder, meaning the body's immune system mistakenly attacks its own tissues, leading to joint destruction, disability, and even premature death. RA affects about 1% of the population, with women being 3 times more likely to develop the disease than men. The onset is usually between ages 35 and 50, and genetic factors, environmental triggers like smoking, and certain infections all play a role. RA can also cause extra-articular symptoms such as skin nodules, lung involvement, and anemia, making it a complex disease that requires comprehensive management. Diagnosing RA involves a combination of clinical assessment, laboratory tests, and imaging. Key lab findings include positive rheumatoid factor, elevated ESR and CRP, and the presence of anticitrullinated protein antibodies. Imaging such as X-rays and MRI helps assess joint damage and disease progression. The treatment of RA focuses on reducing pain, controlling inflammation, and preserving joint function. Non-pharmacological measures like rest, physical therapy, and patient education are important. Pharmacologically, NSAIDs and glucocorticoids help manage symptoms, while disease-modifying antirheumatic drugs, DMARDs such as methotrexate, are essential for slowing disease progression. Biologic and targeted synthetic DMARDs are used for more severe or refractory cases. Early and aggressive treatment is crucial to prevent irreversible joint damage and maintain quality of life. Summarize: osteoarthritis and rheumatoid arthritis are both chronic joint diseases, but they differ significantly in their causes, clinical features, and management. OA is primarily a degenerative disease affecting cartilage and bone, often related to aging and mechanical stress. RA, on the other hand, is an autoimmune condition leading to systemic inflammation and joint destruction. While both conditions require a combination of non-pharmacological and pharmacological therapies, the choice of medication and treatment intensity varies. Understanding these differences is essential for effective patient care and optimizing outcomes. By staying informed about the latest treatment strategies, healthcare providers can help patients maintain mobility, reduce pain, and improve their overall quality of life.